If you are turning 65 soon or going on full Medicare for the first time, then I'm going to show you step by step exactly what you need to do to quick start your Medicare so that 1, it all starts on time, 2, you don't get penalized, and 3, you get the best coverage for your unique needs, philosophies, and budget, and 4, after that, you can relax. Signing up for Medicare and choosing the right coverage for yourself can be complex and confusing. This video should help you out. Hi, I'm Chris Sprang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in numerous other states as well. And my goal is simple. It is to help you maximize your Medicare coverage and make a wise and confident decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. John Mason said, "You were born an original, don't die a copy." If you are turning 65 and are or will be collecting Social Security benefits, then there's a strong likelihood that you'll be signed up for full Medicare, Part A and Part B, and they will just send you your card 3 to 6 months before you turn 65. But your situation could be very different, and there can be certain nuances that can make it more challenging, like retiring but delaying your Social Security benefits. This could keep you from being auto-enrolled into full Medicare, meaning adding your Part B to the Part A. The Part A typically starts the first month you turn 65, regardless if you have and or will continue on group insurance. If this is your situation and you want full Medicare when you turn 65, then you will want to sign up for Part B, ideally 3 to 6 months before you turn 65. You do this by applying for Part B either online at ssa.gov and sign up there, or by going into your local Social Security office if you have one. You can find one by going here. You will have to make quarterly Part B payments to Social Security since they can't take it out of your Social Security check since you aren't collecting one. If you're retiring and coming off of group insurance coverage, Social Security and Medicare don't necessarily know that you will be coming off of group insurance and therefore may not auto-enroll you into full Medicare. So, same as above, if you want full Medicare when you turn 65, then you will want to sign up for Part B ideally 3 to 6 months before you turn 65. If you have an HSA, a health savings account, Medicare says, quote, "You aren't eligible to make contributions to an HSA after you have Medicare. To avoid a tax penalty, you should make your last HSA contribution the month before your Part A coverage begins," unquote. If you're past 65 and a half and still don't have Part A, then you need to stop your HSA contribution 6 months before the Part A starts. Be careful with this one. When in doubt, contact Social Security. You qualify for IRMA. IRMA is the income-related monthly adjustment amount. It is an increased fee or premium you pay above and beyond your standard Part B and Part D drug plan premium. The increased premium goes up based upon your income. As of 2024, it starts at $103,000 for an individual and $206,000 for a couple, and goes up to $499,999.99 for an individual or $750,000 for a couple. Step number 1, signing up for Medicare. You can go online to the official Social Security website, ssa.gov. If you don't have a Social Security account, you will need to set one up. You will need some verifying documents like a driver's license, a passport, and maybe even a selfie that you will have to upload to Social Security. If you can't do that, then Social Security will send you a code in the mail to finalize your Social Security account. This typically takes up to a couple of weeks. If you have, or once you will do this, you will go to the ssa.gov website. Under the Apply section, you will click Sign Up for Medicare. You need to choose either Sign Up for Medicare if you are going to be getting both Medicare A and B for the first time, or Sign Up for Part B only. That means you already have Part A and now you need Part B. So we are going with signing up for full Medicare. So click the Apply Online button. That will bring you to the Terms of Service page. Read that, check the I understand box, and hit Next. Now, under Apply and Complete, click Start a New Application. Click I am applying for myself and answer yes to do you have a Social Security account, because hopefully by now you have set one up. That will take you to the login page for Social Security. Complete your login info that you've already set up. You will be emailed a code, put that in, and click Submit Security Code. That will then take you to the page to apply for benefits and fill out your info. Once you've finished all that, you'll receive a MediCard in the mail within 30 days and many times faster. You will also have access to your MBI, Medicare Beneficiary Identifier. That's your Medicare ID number. You can check the status here at this website, link in the description. Then once you have your Medicare ID, go online to Medicare.gov and set up your Medicare account. This is so you can track your Medicare info, claims, Part B deductible, status, etc. You could go in person by going into your Social Security office and signing up there. You can go to SSA.gov, bottom right of the page, find an office, locate an office, then enter the zip code. That will give you the contact info and the hours of operation. Make sure you bring appropriate identifying info with you. Your Social Security card, your birth certificate, proof of citizenship if you weren't born in the U.S., a W-2 or tax return. You can also apply over the phone by calling 800-772-1213. For deaf and hard of hearing, call 800-325-0778. Step number 2, understanding your 2 options. Now that you have your Medicare set up, you need to take the time to determine which route you want to go for your additional coverage. You have typically 2 options. One is Original Medicare. Original Medicare is your primary payer for Part A and for Part B. No networks to deal with and access to the majority of providers and hospitals. You add a Medicare supplement. For much more detail, check out my videos, the Plan G versus the Plan N, and the High Deductible G, Medicare's Best Kept Secret, which Medicare supplement is best for you. Next, you add a Part D drug plan. Even if you don't take any drugs, you do this to avoid any future Part D late enrollment penalty and not having drug coverage if you are suddenly prescribed an expensive medication in the middle of the year because you can't run out and get a Part D plan any time of year. Only during your initial enrollment period, the annual election period, and maybe a special election period if you happen to qualify for one. When I review your Medicare options, I always check your medications to find you the lowest overall cost drug plan. 2, you could go with Medicare Part C, also known as Medicare Advantage. Medicare Advantage combines your Part A, your Part B, and typically your Part D. You typically still pay your Medicare Part B premium. It is private insurance through companies like Humana, United Healthcare, Aetna, Blue Cross Blue Shield, etc. Medicare Advantage is now the most popular choice for Medicare beneficiaries, with over 50% having Medicare Advantage. But many don't understand what in the world they have, and they've chosen it for the wrong reasons because they were misled and didn't understand the true pros and cons. I will say that after almost 14 years of helping several thousand Medicare beneficiaries, the vast majority of my clients that have chosen Medicare Advantage are very satisfied with their plans. You will want to make sure that all of your providers of choice are in the plan's network. If you go this route, I will check your providers to find out if they are in or out of the plan's network. That way, no surprises. But so you know, providers can leave the plan's network at any time. You will typically have access to extra benefits like dental, vision, and hearing, typically no to low premiums, meaning lots of savings when it comes to premium dollars over time, but you will have copayments for almost everything. So you have the potential for high out-of-pocket costs, meaning greater financial risk exposure as compared to Original Medicare plus a Medicare supplement. Some areas do have plans that have very low max out-of-pockets. If you are fortunate enough to live in one of those areas, then Medicare Advantage is not as much of a financial risk, but still be careful and understand what you have. There is a greater chance with Medicare Advantage that you will deal with prior authorizations and benefit denials. Also with Medicare Advantage, you may end up with a better overall health care experience, especially if you have access to one of the value-based care facilities like Centreville with Humana, Oak Street with Aetna. You can watch my videos, the 3 main risks, the 3 main rewards, the top 10 things about choosing a Medicare Advantage plan, and should you be scared of Medicare Advantage. By the way, I hope you're finding this valuable and you like this kind of information. If so, please like this video and subscribe for future videos about maximizing your Medicare and retirement insurance. Step number 3. It is now time to determine which of those 2 options is best for you. Is it Original Medicare plus a supplement plus a drug plan, or is it Medicare Advantage with all of your Medicare coverage combined? And which route you want to go is predicated upon your overall health, personal philosophies, and budgets, not what a friend or family member has or recommends to you. To do this, you should know the answers to these questions. What is my health status? Do I have any serious health issues that causes me to frequent providers a lot? If the answer is yes, you likely want a Medicare supplement. Am I relatively healthy and take care of myself and don't visit doctors and hospitals a lot? If that answer is yes, then a Medicare supplement plan like the high deductible G or N, or maybe a Medicare Advantage plan. What, if any, prescribed medications am I on? Make a list of all your medications with the exact name, dosage, and quantity you take per day. You will need this if I help you. What providers do I need or want access to? Do I need or want access to a specialty hospital? If that answer is yes, usually you want a Medicare supplement. Who are my doctors that I routinely see? Make a list of the names of your providers so we can make sure that they are in the plan's network should that come up. Would I prefer paying a higher premium to avoid the potential for lots of copays and have less issues with prior authorizations and benefit denials? If you answered yes, then you want a Medicare supplement. Other than the premium adjusting every year, would I prefer to set it and forget it? Set it and forget it equals a Medicare supplement, especially a Plan G. Or do I mind the potential of changing plans every few years for the benefit of no or lower premiums and to get some nice extra benefits? If you don't mind some change and some more risk, then you might want to consider the Medicare Advantage route. Or am I willing to deal with the potential for lots of copays if I can save thousands of dollars per year in premiums and get some nice extra benefits? If you answer yes to that, then Medicare Advantage or Medicare Supplement High Deductible G without the extra benefits. Am I willing to deal with the greater potential for prior authorizations and benefit denials? If you answer yes, then Medicare Advantage. Do I travel a lot and split time in various states? If you answer yes to that, which is quite common, then a Medicare supplement or maybe a Medicare Advantage PPO plan, ideally with a passive network. Do I qualify for Medicaid or financial assistance from my local hospital? If you answer yes to this one, then you can go with original Medicare plus a Part D plan or a Medicare Advantage plan as long as it makes sense to you and you understand it. This is also where I can help you make a wise and confident decision. You can schedule a consultation call with me where we will review all of these things and I'll answer whatever questions you may have. And you are never obligated to enroll through me, but I hope I can earn your trust and your business. Step number 4. Enrolling in additional Medicare coverage. Now that you know which option you want, if I haven't already, I'll need to collect a Medicare required document called the Scope of Appointment. This document simply gives an agent permission to review plan benefits with you when it comes to Medicare Part C and Part D. It doesn't obligate you to anything. I know it's silly and annoying and it should be gotten rid of, but it is required. If I haven't already, I'll check your prescriptions to find the lowest overall cost drug plan. If I represent that company or one of the lowest ones, I'll enroll you in that plan. If not, I will give you that info and advise you to contact the company directly. If you want a Medicare supplement, then I'll give you quotes on the different plan options. So you know, I represent every major insurance company that offers Medicare supplements. Once you choose which plan you want, then I'll enroll you in that plan. If you want a Medicare Advantage plan, I will review the drug coverage for these as well. I'll check your providers to find out their network status. We'll review the plan benefits, and I'll enroll you in the plan of your choice. Step number 5, relax. You are done. You'll receive your new policies or cards usually within a few weeks. Once your Medicare and plans become effective, you may want to contact your primary care doctor and schedule your Welcome to Medicare visit. With your primary care physician, determine if you need to take advantage of any of the no-cost preventative services covered by Medicare, like cancer screenings, vaccines, and a colonoscopy, etc. You can contact me at any time you have a question or concern. You can review your drug coverage plan during the annual election period from October 15th to December 7th, but only if you happen to take brand name and or more expensive medications. If not, unless something radical has changed with your drug coverage, like the premium, then simply roll over to the next year. Review every few years your Medicare supplement. Once your premium goes up by about 50%, and it usually does in a 3 to 5 year time span, then we see if we can find the same plan, sometimes with the same company, but for less money. Unless you live in a state that offers some guaranteed issue right for a Medicare supplement after your initial enrollment period, then you'll need to medically qualify for it. So that's it, your 5 steps to a Medicare quick start. If you have any questions about what I've just gone over, or when you want my help maximizing your healthcare coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I'll do my best to answer any questions or concerns you may have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or plans of your choice, and of course be available down the road for your support. If you happen to live near the Charlottesville, Virginia area with an hour to an hour and a half and you would like to meet in person, then please reach out to me and we can probably work that out. That is it for today. If you want to stay up to date and gain more insight on maximizing your Medicare insurance, then please consider subscribing. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.